want to close by asking you about the pricing transparency regulations that were implemented and really have been being implemented over the last couple of years. And it feels like the federal government's going to continue to kind of hone in until it's understandable for a third grader, for lack of a better term, right? Because it's very complicated. Can you talk about your role in working with Providence, again, as a ministry, to say, hey, let's not just meet the federal government's requirement. I know Providence is on a website saying, here are the hospitals that are doing their best, that are doing this, that aren't trying to hide their data. So can you talk about your role in making sure your prices are not only posted, but posted in a transparent, understandable manner?
Yeah, and that's a work in progress, right? We've got 170 years of complexity to now, simplify. So as you mentioned, we'll obviously follow any federal and state government regulations, and we'll meet those needs. How we present that transparency, how do we move to more consumerization of our tools and experiences? You didn't bring that up, but the way we interact with our health systems feels about 15 or 20 years behind other places. So how do you build that kind of consumerization into health systems and transparency and access and scheduling, like we have in other industries? So there's more work to be done there. And then how to use that price transparency to also build internal efficiencies, right? Because, what we are able to deliver in Texas may be different than California, that may be different in Washington. So it'll also help us become more efficient as a health system. There's obviously the transparency to our patients and communities, which is important, but I think it'll also be an enabler for us to drive our own efficiencies and, kind of benchmark ourselves internally as well. So I see multiple benefits, but it's a journey, right? We're not there yet, and there's a lot of work ahead of us to make progress on that front.